Dr. Rifkin, again, is here in Beverly Hills. He works a couple blocks down from me. And he was, if you're wondering who gave the Lakers their nice smiles for 20 years, it was him. The cool thing about Dr. Rifkin is he's a dentist, but he's like this other guy who does a million other things. And one of them is being an artist. And he sculpts amazing sculptures. And he's not one of those doctors who kind of went into it just to make a sculpture and show it to other people and say, hey, I'm a sculptor. He's actually like legitimately amazing at this and has this stuff.
Thanks.
All over his house.
If I lean over, there's one back there.
Yeah. No, they're amazing. All over his house, all over his office. So he does have an aesthetic eye. And past that, you got to have the medical know-how. And he certainly does. And he's got a lot that we could talk about for days. But the thing that really I wanted to kind of focus on is everybody's always asking me about, like, what should I do about my gummy smile? And there's obviously not one answer. So I wanted to kind of go through like what causes gumminess in different people and what options do we have that are easy or more difficult for them, and what are people missing? So the first, just to talk about gums in general, most people don't want to hear too much about like gum treatments, but it's a huge benefit. If you go to the dentist and you're going to get your teeth looking nicer, I mean, you have to kind of look at the gums too. So, wrong photo. Let me.
Well, that's actually a good one to talk about health.
There we go. So let's see. Oh yeah, here we can talk about this one. So when we're looking at the teeth here before and after, I would want to kiss that person over there more than this person. But why is that? They look cleaner and healthier to me. What's going on there other than the tooth color?
That's a really good point. You know, the foundation of health or beauty is obviously health. You wouldn't treat a patient surgically unless they were healthy. You got to clear their medical. So in dentistry, before we do anything cosmetic and restorative, you got to get them to health. Now, the problem with this patient, she came to me having her teeth done with veneers twice in Europe. She was from the Middle East area, and her complaint was that her gums were bleeding and they were hurting her. And so she had just the top teeth done. Thank goodness. I think that was a benefit. Otherwise, she'd have had more problems on the bottom. But the problem is, and I didn't show the x-rays because I know we have a limited amount of time, that the two dentists probably that worked on it, because she had it done twice, over-prepared the teeth when this poor young lady, she was like 21 years old. She probably didn't need anything, and maybe just some teeth whitening and maybe some minor orthodontics. But if you're committed, if there's a reason to do procedures that are irreversible restorative, you need to be minimally invasive and you need to be very respectful of the anatomy. So in a nutshell, they over-prepared the teeth, they went too deep underneath the gum tissue, and they violated the connective tissue that holds the gum tissue to the tooth and the root. So when you put the veneer underneath the gum tissue far too deep, you cause a chronic inflammatory response. It's just like having a splinter in your skin and never pulling it out.
And they get these puffy, beefy gums, and beefy. They're beefy. They're not very delicate and clean.
Yeah, the sign of it is obviously there's bleeding, there's puffy and redness, and you know that inflammation or infection is, the rubor. So you've got this really smooth, puffy gum tissue that bleeds when you touch it gently, and it's because it's inflamed, and this chronic inflammatory reaction cannot be resolved until you remove the source of inflammation, which is remove the old veneers, unfortunately, again. So before you can go and correct this, quote, disturbance of the anatomy, you have to give it time. It's not one of those you can do it in 1 day or 2 weeks. You have to give it enough time for the body to respond. So the important thing here is that I removed the veneers and crowns that were there. She had multiple root canals because it was just really poorly done. And we put beautiful temporaries on there for two purposes. One was to get the gum tissue healthy. Two was to reevaluate and design her smile and her new teeth relative to her face, which we'll get into in a second, and really let the gum tissue respond. Sometimes you need to do a little bit of minor gum surgery, but in her situation, just some minor gum surgery, gum lifting, putting on really well-fitting temporary veneers and giving it time with good oral hygiene, her gum tissue responded very nicely. And as you can see on the slide on the right, that's the final result with new veneers and crowns on the upper and lower teeth that were now in harmony with the gum tissue. So you see really healthy, pretty gum tissue, no bad breath, no bleeding gum tissue.
Yeah.
And the lower teeth could have been whitened, but not to degree of whiteness that she wanted, so we did veneers on the bottom. And so that's just an example of the foundation that has to be done. So whether you do, like you do, man, you do amazing surgery. Your goals are to have a beautiful result and no scars and no inflammation or no infection. Same thing with me. We've got to do this in harmony. So this is the foundation of health. The teeth look pretty, but this really has nothing to do with our main topic of the gummy smile, which this is something that we need to now look at the face. But the foundation has to be done well. And I use the dental operating microscope to be precise about this, so I can be minimally invasive. Like here's a beautiful example of a before and after natural result, not overly white, not Hollywood smile, a pretty blended smile with just 6 veneers on this young lady's teeth, which she had modeled enamel.
So you didn't have to redo, this person came to you and you didn't have to go redo everything and give her big giant white teeth. You gave her what she should have. You gave her something that's appropriate for her. And that looks nice to me. And most people, they want to see this crazy big white, like horse smile that you would see in like There's Something About Mary, but that looks horrible. It looks done. And I was talking about this the other day. It makes people look fake. They look fake in plastic. So you don't have to get plastic surgery to look fake. You can do it with terrible eyelashes. You can do it with terrible makeup. You can do it with bad, big, nasty teeth that don't match you. And the Hollywood smile, which Dr. Rifkin refers to, you walk around LA and somebody smiles and it looks like they've got like this neon glowing teeth and they're in like a dark room, and it brightens up the room in the wrong way. You don't want your face to be like a pair of headlights that's just like shining into somebody's face. These are the right color. They're natural. They don't look like they've been touched. That's what I prefer. And that's what I help my patients understand when they're asking me which dentist to go to. I say, well, there's a lot of cosmetic dentists out there. There's a lot of famous ones, but there's a couple who do natural work. And this is what I mean by natural.
Thank you. And then the same to me. Patients say to me, if I we work together. So when I refer a patient to you, I say, well, I really want to have a facelift because my face looks too pulled. I said, you always can tell a facelift. I said, you can't always tell. You can always tell a bad facelift. You can always tell a bad rhinoplasty. Yeah. But if you don't notice it and it was done, that to me is my goal. And I know that's your goal because I've seen your before and afters. And if you just showed me the after, I could never know that anything was done. And to me, it's an insult to me if a patient of mine walked down the street and somebody came up and said, hey, those are great veneers. Who's your dentist? Yeah. If they noticed they were veneers, that would be a failure for me. And that's not what I want. So of course I can do overly white and the Hollywood smile. That's easy. Yeah. To make it blend in and camouflage and make it look like it's appropriate for your face and your lips and the rest of your teeth. That's the challenge to me. Just like you do a rhinoplasty, you could probably make a nose 100 different ways, but you have to look at the whole face, and that's the
and Alex, so I've never had you analyze mine. So let's see my gums. I don't know how to show it to you. Are these okay for you?
Your gums look very healthy, and I love the proportion of your teeth. Obviously, they're natural and they fit your face. So unfortunately, I couldn't make a living off of you, but I would be happy to find the fact that you are really in good shape and good health. And that's what I want to maintain anyway. I'm kind of joking about the living, but when you need it, or when it'll be a benefit. But in a case like yours, if you came into me, and many patients that have a nice smile like you come into me want veneers, I don't think it's appropriate. I think it's actually it's unethical to do treatment on someone that has a really nice teeth, unworn teeth, healthy gum tissue. And it fits your face. That's why I like natural looking beauty. Yeah,
it's like giving me a boob job. I don't know if I need it. I mean, I wouldn't mind, I guess. But so
I need you though. I'm ready for you to do this. I'm getting ready for that.
Well, you got it. So look at this. And this is a slide that you had put together when you're kind of talking to other dentists. We're trying to look at like what makes people gummy. And we'll start with like the easy one, which is, well, let's actually go back to like the anatomy from the side, which, you have the slide up here. Or let's go to this is another one. Let's look at here. When we're looking at like what makes somebody show, if you look over here, too much gums, we've got the lip being too long. We've got the teeth and the gums being too forward, too far down, and just an overall kind of mismatch of this stuff. So how do you go over this like algorithm? How do you analyze it?
That's great. Well, first of all, I look at the entire face, and obviously we assess the patient's goals. And if they truly have a problem, we have to diagnose accurately what the problem is. And this is kind of my algorithm of step-by-step process from my diagnostic gathering of information, and it has to be measurable. You know, we all have various faces, but there is some commonality in certain measurements that within a range are aesthetic or unesthetic. And so, like what many things that I learned from you about the lip lift, when is it appropriate, when is it not appropriate, what do you need to do? Like that previous slide of the patient. Yeah, beautiful. So if we look at the face, you know, the face is divided into an upper third, a middle third, a lower third. And then if we just take the lower third, which is kind of my arena, and I look at that, I can break that into 1/3 and 2/3. So if you look at that slide, this is a before and after of your case that you thankfully allowed me to borrow and show to other dentists as I lecture and learn from. On the slide on the left, her upper lip from the base of the nose to the bottom edge of the upper lip is much longer than 1/3. And what we have studied in dentistry, and of course we're not plastic surgeons, but we do know the mouth anatomy, that the upper lip, the range of normalcy, of normal length of a youthful, unaged smile is about 18 to 22 millimeters. There's another slide that I have that if you lift up your lip to determine whether it's a gummy smile, it's also about 20 millimeters from the base of your nose underneath your gum tissue to the edge of your teeth. So when we see a gummy smile, and this patient is not a gummy smile, she's a no tooth display smile, her appropriate treatment would be for the lip lift if we determine that phonetically the length of her teeth is appropriate and the size of her teeth is appropriate.
So tell everybody what phonetically means, because this,
phonetics, yeah.
This is
speech,
important.
When you say certain sounds, especially F sounds or V sounds, your lower lip contacts the edge of the upper front teeth, allowing you to say an F or a V. If it's too short, you get this really soft sound of an F, it's like a F instead of F, you know. And the F sound is also affected by the position of the teeth and the tongue. So the length of the teeth should be appropriate for aesthetics, the way the teeth look, how much tooth display, even when you're not smiling, like on this beautiful result that you show. She shows about 2 to 4 millimeters of edges of her front teeth when she's not smiling or in what we call repose. So we look at the phonetics, the function, because you have to function, and you also have to look good. Her upper lip was obviously too long. I didn't measure it. Obviously you did, but I would guess she's about 3 to 4 millimeters longer than she should be. And your lip lift elevated the lip she's not smiling. So she didn't have to touch her teeth. That's the beauty of the proper diagnosis. Her lip was the problem, not her teeth. And I have many patients that come to me, perhaps you too, that either have a longer upper lip or they have overfilled their upper lip. Now they want to show their teeth because they don't show them anymore.
Yes.
And so they're chasing their lip with their teeth. And I think that also is a misdiagnosis and a mistreatment. So you have to know what's the problem. Is it the lip? Is it the upper jaw? Is it the teeth? And we go through that differential diagnosis, then we can decide who does what.
Yeah, and we'll go over the different types, but for people to understand, when you want to be a lip lift surgeon, when you want to be a cosmetic dentist or an orthodontist, orthognathic surgeon, you have to understand phonetics. You do have to understand lip function and what they would call an incompetent lip or a poorly functioning lip. You have to understand these things. You don't want to be the person that can't say the F word. Your life would suck. You can't.
Exactly. You know, if I can't say the F word,
you can't say like buck you. It's too soft. So, but these things are really important, and this plays into not over operating on somebody, which is what you see a lot in lip lifts, and I've seen in some of the patients that I see who are operating on other places where they did a lip lift when they didn't need it, and they came back, and what happens is now they're too toothy, and even though they don't realize it because they love the way their bright white teeth look, their chin starts to dimple up over time because their lower lip is struggling to go meet the upper lip for phonetic reasons, for lip mouth closure reasons, and they start to get a hyperactive lower chin. Those people start to look sad over time and depressed and angry because they start to get hyperactive depressor function. And that is a reality for a lot of people. Maybe a couple of people get away without it, but the reality is most people will start to age like that. So phonetics and the closure of the mouth is very important. If you're going to tamper with the mouth, you better know this stuff. And if you don't know, then ask Dr. Rifkin, he'll explain it to you. And I mean this mainly for the plastic surgeons who are overdoing lip lifts. Like, you really have to look at the lip function and understand there is a huge difference on doing a lip lift on somebody who has teeth that are out to here versus that are back here, because somebody who has normally soft, I'd say, balance and their teeth are positioned properly can get away with a much bigger lip lift without causing problems in phonetics or mouth closure. Somebody who has them prominent, even if the lip is long and you want to do a lip lift, doesn't mean you can do it, because I do have patients where I look at them now and I'm staring at them every day on social media, because I do, see some of my patients, and they can't close their mouth when they talk, and they sound a little weird. They sound like they just had a dental procedure done where something's like numb,
Right.
And they can't like close their mouth as they talk. They kind of talk like this, and they can't, the upper lip stays up there. That's an improper use of a lip lift. And let's say they have a long upper lip, but they're also prominent, and you're dying to do a lip lift. Well, go get the dental stuff done first. And we'll talk about that now. You did have a slide. I don't know where it is actually on my phone right now, but
I did want to ask you a question though, because it's difficult to retreat or do a correction. Like that last patient that I showed you had the puffy gums. That took time. It was correctable, but it was not easy, and took time and a lot of precision. When you see a patient that has had an overly lifted upper lip, how difficult is that to correct, or is it correctable?
It is very difficult to correct. It's not impossible. So some people who are desperate, can be helped. Desperate. The people who are overlifted in general, no, you can't be helped. You can't reverse it. It will relax over the course of the next several years, and you just wait for it, and you can't do anything else to help it. And the more you try to stretch it out to bring it down, the more it's going to scar in that time. And you're just replacing the tightness with a scar, and then you have to fix that anyway. So I tell people, don't do that. The desperate are different. The desperate people who have severe issues can lengthen it with local flaps, like you would reconstruct a cancer, or skin grafts, which
I see. Yeah.
They look weird, but they will restore a little bit of the height. And assuming the muscle hasn't fibrosed and the muscle is still there, it'll stretch back out a little bit again. Or if they have been overlifted relative to their teeth, the teeth can be moved up. So if you have a little bit of vertical maxillary excess, the gums in the teeth and the alveolus, the maxilla, it's too low or rotated, you can counter rotate it and kind of bring it back in. So those are options that people miss a lot of the time when they're struggling as to what do I do with an overlifted lip. You can go do the dental work and actually bring it back that way. But if you're desperate, yes, you can do skin grafts and local flaps. Otherwise, it's not a reversible surgery. So people do have to be very careful about doing it in general. You have to go to somebody who's an expert, who does understand what you're talking about, who understands the teeth. If you don't understand the teeth, you should not be in the world of lip lifting. Like if you don't understand the eyes and problems with vision that you can cause, or eye mobility or things like that, you shouldn't be doing lower eyelid surgery. Like you have to have a basic, nice understanding. It doesn't mean you have to know how to treat an eye like an ophthalmologist, but you have to understand their world. And if you're going to do lips, you have to understand the dental world. And if you don't, you shouldn't be doing it. So, but what are other examples of, like, let's move away from lip lifts, saying like, let's go towards gumminess and gummy smiles. I actually have a better version of that photo. So this is somebody with a gummy smile and bowing. So this is also a big mistake, is a lot of surgeons, they think the lip is shaped like an M on top and on bottom. And they go and they start making these weird, this is mainly in like Korea and some Iran, a couple other countries that do it, but they go cut out this shape here like an M on the bottom of the lip, and it looks like her before. They end up looking like an M all the way across. So I advise people never to do that. But what you did here is beautiful. This is a gummy smile. There, I didn't like the gums so much, how they show. The teeth are a little bit kind of misshapen, and there's a lot going on. And now she just looks softer, plush, and more relaxed when she smiles. And I'm not even looking at the whole face, but I can tell she looks more pleasant. So what was the cause here of this, and then what did you do to fix it?
Yeah, great question. This was a good learning experience for me on doing a comprehensive differential diagnosis on her, because she had multiple little minor blemishes that were affecting her smile. And cumulatively, she has an unattractive smile in the before. And she had come to me for multiple opinions, a third or fourth opinion, which I actually think was in the favor smart on the patient, because one doctor said you have VME, which you know is vertical maxillary excess, which means your upper jaw, the skeletal system is just too long and too low, pushing the gum tissue and the teeth down below the level of the lip.
Mm-hmm.
So they wanted to do what we call a Lafort osteotomy, a maxillary impaction, which is a pretty significant surgery. Requires orthodontics, requires jaw surgery. It's pretty routine, but it's not something that simple.
Yeah, you have to be very committed to it.
Exactly.
A great surgery.
Doctor said, let's just cut the gum tissue up 3-4 millimeters. You have to remove some bone. Then your teeth will be too long, but we can shorten your teeth and put veneers up so they get to be the teeth of the right proportion. And then you won't have a gummy smile. So if we look at her teeth, and she said, well, I don't know if I want to do that. And I'm glad that she did. She says, what are my other alternatives? She said, would like veneers be enough? And I said, you know what? Let's take a look at everything. Let's take a look at the lips. Let's take a look at the gums. Let's take a look at the teeth. As you said, Ben, the teeth are kind of crooked a little bit, not great shapes, slightly compressed on the sides, what we call the buccal corridor, the space between the cheeks and the teeth. But the gum tissue is actually quite healthy. If you ignore the shape of the teeth and you look at the cumulative scallop from right to left, from front back to front, the gum tissue is really in a good level. There's nothing wrong with her gum tissue. It's very healthy. The teeth are a little rotated. Orthodontics itself probably wouldn't help the shape of the teeth. They might position a little bit better. But if we look from the outside in again, we look at the upper lip, it's thin compared to the lower lip. She has a really full lower lip and a relatively thin upper lip. Now, I didn't really have the measurement from the base of the nose, but she actually had a short upper lip and a thin upper lip, and especially in comparison to her full lower lip. She had healthy gum tissue, teeth that were slightly compressed and kind of crowded, and her lower front teeth, because of her deeper overbite, if you understand the function, protruded up a little bit. So we needed to level those out, respect her bite. So what is the solution here? It's not really VME because she measured properly skeletally. Her teeth proportions were not ideal, and the gum tissue was very healthy. So 2 surgical procedures, other than perhaps, unless at that time I would have known that you maybe could have performed a different upper lip procedure to maybe increase the fullness, my solution was to try on what we call a temporary smile, a Hollywood smile, a snap-on smile. There's lots of different things to do that. A reversible try-on. So we did some temporary veneers in the shape of the final veneers in acrylic, so we could get a sense of what would happen. What we found out is that the teeth proportion were much improved relative to the lower lip. So now you don't have this huge lower lip and small, tiny upper teeth and this thin upper lip, making her look very bottom heavy. But this upper lip was still thin. So then I said, and I learned about neuromodulators, Botox, and when she has a hyperactive levator labialis muscles that elevate that lip when she smiles, because she's a very happy person, very, very gregarious. We found that with neuromodulators, she could reduce the elevation of the lip without affecting her smile. And then with a little filler in her particular situation, and I know that you have your very, learned, wise opinions about different fillers, and perhaps fat would have been the better solution. But my combination of try-on and trial treatments were to do veneers, because we tried them on. First of all, it wasn't. It was reversible. It was just a try-on. It could be done digitally as well, but she could actually wear this 3-dimensionally. And then it was for neuromodulator or Botox injection on the middle of the upper lip, reducing that lip elevation and a little bit of filler. So now what we've accomplished is we've better proportioned the relationship between the upper lip and the lower lip, so they're not one is so out of proportion, and the teeth as well to that, without doing any surgery of gum tissue, without doing any skeletal surgery. So with just some forethought and a little bit of reversible trial, we figured out a way to improve that smile, and you can see it turned out, I think, great. Maybe today we might have modified the porcelain a little bit, but you see I'm looking at a very natural look. So we built it out, made a longer proportion. We built a relationship between the teeth, gums, and the lips.
And I think it looks a lot softer, a lot more relaxed. And a lot of patients will ask me and you, well, I did this, I'm very happy with it, and I want to make it permanent. how do I make it permanent? I tell them there's not always a permanent answer for your solution. You have to understand that we're dealing with something dynamic, and something dynamic is going to change. Your muscle function, your nerve function is going to change over time, and the muscle needs to function. We can't program the muscle not to function more, and we can't just go cut it because it's going to have some issues. So Botox becomes the answer for this, meaning not just Botox, but any of the neurotoxins becomes the answer for this, where every once in a while you do it. Unfortunately, when you weaken a muscle, some people tend to atrophy or weaken over time. So you can actually do this less and less as you go along. So instead of every 3 months, every 6, maybe every 8, especially in the gummy smile, I've noticed that it does respond more over time. And then they ask about the volume in the lip. And I say, well, filler is your easiest, best option. If you're okay with maintaining it, that's still your best option for somebody who just wants basic volume, because injectables aren't always predictable. And, we can always try fat, but if we do a little, it's probably safe. A little more than that, the fat can migrate, it can hypertrophy, it can do a lot of things. So a lot of times, you do the permanent part, which is the teeth, make it look nicer. And then this becomes touch-ups every once in a while for maintenance. What about this case over here? Unfortunately, the photo didn't edit properly, but this one, she's just, her lip, this is actually something that's nice to look at. So if everybody looks at her lip, the lip is rolling up above the gum line. So not just this gum line, but above the alveolus, rolling over it and getting trapped all the way up here. So it's kind of like what Fire Marshal Bill used to do. So like, Jim Carrey in Living Color. And you can see the amount of strain that goes across her lip as it's folding here and folding there. That means that her lip is completely compressing across the gums and pulling up, either because the lip is too long or because the teeth are too long. So something's happening where it's compensating, or the function of the muscle is too much. So what did you do in this case to get it to relax and look softer?
This is a patient of mine that had veneers done by a previous dentist who did a relatively nice job. I always give credit where it's due. Her skeletal anatomy was such that she really did not have VME, but she had this kind of strange curvature where her alveolus curved inward towards her nose a few millimeters above the gum tissue. So this is where, when she smiled, as you rightly noticed, her lip would kind of get trapped underneath this concavity in her maxilla. So if we could have filled that in, would it have elevated that high? Perhaps we wouldn't know that. But the problem was she had, again, a very strong upper lip levator muscles, and she did not have a skeletal problem, and her teeth were in good proportion. Her gum tissue was very healthy. So, and her upper lip was not thin, as we can see. So this was basically, again, a simple Botox or a neuromodulator, any of the other neurotoxins, to reduce the amount of lip elevation, and that was it.
I see.
No surgery, no change in anything, just that. Now you're right; it needs to be repeated, but what are your other options?
There aren't great options, and it's very easy to maintain. Just somebody, people don't complain about having to go for a haircut every once in a while. It's not that different. It's a tiny little.
You're right.
Well, it takes just as long.
Yeah, it's not a big deal.
Yeah, these are maintenance things in the way.
So this is the diagnostic part of it. What do we do? Is it muscle? Is it soft tissue? Is it hard tissue? Is it position of the teeth? Is it wear of the teeth? What's going on here? What is the real diagnosis? So with a few simple measurements, my algorithm, your algorithm, I know you measure lips and angles, and that's really hugely important because I know you understand the dental part of it. And you could almost be a dentist, but you don't want to be one. And I'd love to be. I love to know about cosmetic surgery to help my patients to know what the options are. But I'm not going to be a cosmetic surgeon, but it's important for me to know because therefore I can refer to someone that would do the right solution in the right way and not mess it up.
Yeah, and this is the mentality now, more kind of openly, of I think the better doctors who are really getting better results is, and this is what we're seeing with the whole kind of orofacial societies and everybody coming together and working together, is that it's so important that the people who have gone to these meetings, like, we can't stop talking about it, because if you treat the mouth, you should know the mouth. You should know the mouth and the surrounding part of the mouth, not just the teeth, or not just if you're orthognathic, you know, just this, or if you're dental, you know, just that, or if you're perio, you know, just the, you know, gums. Like you have to know everything that's available in general. And you can think about it when you're at home and about whatever cases you treated. And you have to think back and say, did I treat them properly? Or would it have been better if somebody else did this first? And that really gets the patients the better results. And you're able to treat more patients, actually. So instead of me saying no to patients who are not eligible for a lip lift, I look at them, and people wonder, well, why do you do so many lip lifts? You say yes to everybody? I'm like, no, I don't say yes to everybody. I say no to a ton of people. I'm able to do it to more people. So I say yes to more people than other doctors can say yes to, because I can do it with much more precision. But I don't say yes to everybody. I say no with certainty to some people, and I say no with an exception to some people. So some people I say no, except for if you wanted to go see Dr. Rifkin and do this. If you wanted to go see, if it's worth it for you to go through this, for you to go see Dr. Sintra, who's an orthognathic that we were talking to in Brazil, or Dr. Relly in Los Angeles to do this. If you want to, you know, move the teeth up and in, then a lip lift is going to be good for you, and it'll complete the whole look that you're going for. If they're not going for that look, I don't push them in that direction, because it's two different doctors they got to see, two different surgeries they got to do. But if they're going for a specific look, I have the option now to say, even though I can't do it, you can go to him, he can do something for you, or go to him, fix this, now I'll be able to do it. And that's really the great thing of everything working together. And the photos that we don't have right now are the other part of gumminess, which is what we're talking about in vertical maxillary excess, where if so, you know, this is for people just to walk them through it. When you're looking at somebody's face like this and you kind of look at all the different proportions, the teeth and the lip, you kind of look at it as a balance. Now we use our numbers as guidelines, but let's say you forget the numbers, because I don't know the exact ones. You just look at somebody, and if it looks like their gums and their teeth are just too low and forward compared to the rest of their face, that becomes an orthognathic procedure generally, where you have to go actually do osteotomies, take the teeth back up, move them back in. And that's the other part of gumminess that really you see very, very often, and people walk around with for years saying, oh, I just want to get some Botox to cover it. Oh, I just want to do this. And I tell them, listen, Botox is not the answer. I'm like, you're putting a Band-Aid on it where a Band-Aid shouldn't be placed, because there are Band-Aids that you can do.
Right.
Yeah, but I think the algorithm that you kind of have that are, you know, that you go through on how to look at somebody and really look at it in the microscope and look up close, look at the gums, look at the teeth, look at the whole. it's really, really helpful for me. When people come to me with a gummy smile, it's this. That's all I can do. It's kind of you know, I didn't touch the teeth. I can't do anything. I touch. This is a little Botox, a touch of filler, and that's it. And the benefit from it's simple, it's easy, and it goes to the rest of the face, where if you look at the nasolabial folds in the cheeks, she's smiling huge in the first one. Yes, that's cute when you're 20. As you get older, that starts to indent you more and more, and it becomes more of a strained smile, and you start to get deeper and deeper lines, especially if you're a smiley person. And I love smiles.
Don't look anymore. Can I make an appointment Monday? Are you open?
Yeah. No, you look too good. So I mean, I think you have to show everybody your biceps so they understand how like in shape you stay. It's crazy. So everybody, you know, they see these photos. I think you have to really look at the gummy smile, figure out where it's coming from, and then see the appropriate person for that. It could be your plastic surgeon that you've been going to for years. Maybe just ask them about it. And they might say, nope, no, not for me. These are actually gum problems. This is actually, you know, or you go to your dentist, and the dentist, cosmetic dentist who's trained in it, is going to say, nope, this is what you need to do first. And at the end of it, I'm just going to put a little dot of Botox here, dot of Botox here, and we're good. And that's how most of this stuff should go. The only way to know is if you do a consultation. You can Google all you want. It's a nice thing to do, but it's not always going to get you the correct answer, because there's so much that goes into decision making that Google kind of complicates things sometimes. So questions we have: does gummy smiles have anything to do with gummy bears?
Well, we use gummy bears to actually remove temporary crowns. They're very sticky, and they just drop them right off. That's about the best thing I can say about gummy bears. I don't have a particular flavor.
So if somebody's doing a rhinoplasty and they're going to be getting the tip out of the way, the lip will be more obvious, the teeth will be more obvious. When they're doing veneers,
Mhm.
Does it matter if they do one procedure before or after the other?
I don't think the rhinoplasty will affect the veneers. You know, lip lift,
Mhm.
what that would be a proper sequence that you and I would
Correct.
discuss and say,
Yeah.
okay, what do we need to do first? As far as I know, you're so careful with your modified deep plane, which I'm kind of learning about your surgical technique. Not that I really understand it, but I know that you're respectful of the musculature and how to get the proper elevation and not too much.
Mhm.
So I would think a rhinoplasty would not really affect it unless you think there is some musculature that would affect the lip elevation and show more teeth. But the teeth
Right.
should still be the same proportion.
Yeah. Yeah, I agree. I feel the same way about it. The time that you need to plan is if you're doing a lip lift and a rhino, those you can figure out which ones to do in what order. Or if you're doing tooth lengthening and a lip
Mhm.
lift, or shortening and a lip lift, then you have to figure it out. And I tell people as a generalization, complete generalization, if you're shortening,
Mhm.
um, then I would say you can do the lip lift first, maximize it, and then shorten accordingly. Oh, sorry. If you're shortening, do the dental work first, shorten, and then do the lip lift. If you're lengthening, do the lip lift first, then do the lengthening to avoid over lengthening. That's like the generalization. But if you have good communication between the dentist or the orthodontist and the plastic surgeon, then kind of leave it up to them, and they figure out where their problems and predictability lie, or whoever can do it more predictably in what order. Um, and the question, so this is, would Botox help or other injectables with the upper lip and my gummy smile? That's kind of what we're talking about the whole time.
Mhm.
Yes, it definitely can, but this is all, again, based on your anatomy and looking at, how to go about it. So
Right.
I'd say you have to get a consultation with somebody who's good at smiles, and that could be your plastic surgeon, could be your dentist, and they will guide you in the right direction as long as
Sure.
they know the right stuff.
Right. In dentistry, we're basically using Botox for either clenching of the muscles. You have a lot of pain in the jaw muscles or temporalis muscles from clenching as you grind your teeth, for pain relief, and a limited amount for gummy smile. Anything else that Botox might be used for with a benefit should always be uh, looked at by a cosmetic surgeon such as yourself to know what other things are going on with the face. Is it better to fill volume and not, maybe you got to do cheek volume. I mean, you're the expert in this,
Mhm.
versus Botox in another area. Is it muscle, or is it loss of volume, or is it skin texture, or
Yeah.
aging, or what? So
Yeah.
that's
And-
where Botox as a neuromodulator has its limits. In dentistry, it may have benefits, but obviously, see someone that knows the true problem can diagnose your face
Yeah.
entirely.
Yeah, and I personally, in the past 2 years, have I've developed a much greater understanding of the face just from the function of clenching and straining and these kind of things. And I was talking to Octavio Sintra the other day, who's the orthognathic friend of mine in Brazil, and we're looking at his before and after photos. And I asked him a couple times, "Did you do Botox on that person? Because their face looks less strained."
Mm-hmm.
They're not doing this anymore. They're not doing the asymmetric pull anymore, and they're not straining in a harsh way. Their face looks softer, in addition to being more proportioned. And it turns out, which makes sense, when the soft tissue kind of cover sits more appropriately on the skeleton, it functions better, and it doesn't strain as much to do what it needs to do. It's more relaxed because it's in the proper position. It doesn't need to compensate. It doesn't need to do that kind of stuff. Same goes with the teeth. When the teeth are in the proper position and the gums just by themselves are in the proper position, the chin, the lower mouth, all of it stops straining. So all that down pull starts to relax. And I've even seen with clenching, when you get people to clench less, they also, people who have like a strained lower face and bulging here, it tends to slim it and then relax that part of the face as well. And furrowing, people get that one, obviously. You look strained and you do this. And so Botox does kind of magic on its own when people do have this strain that kind of keeps going on.
If I could make a couple comments on the skeletal system, and when I learned to sculpt, if I was doing a facial portrait, I would learn to build the skull first. Then I would put the anatomy on, and then I would put the skin on. So when we can develop symmetry and proper proportion of the skeletal system, the skin automatically drapes over it in a more symmetrical fashion, and the muscles don't have to maybe perhaps compensate. So I've learned to build a sculpture in layers, and I call it layered aesthetics. So we've been talking about this in kind of a roundabout way, that it might be vertical maxillary excess. We might need to do the skeletal system. No veneer is going to help that. No lip lift is going to help that. That's a different underlying surgical correction, building the structure from the inside out, like you're building a home. And so the layers are important to think about that. Look through the surface into the inside and know that the reason this cheek has a highlight on it is because there's a bone underneath it that's pushing it out and light's catching it. So reading the light artistically, seeing through the skin, when they say you have good bones, that's really not wrong, to see beauty. So we need to correct the skeletal system, which could be cheekbones, could be chin, could be teeth, because that's where the soft tissue lays on top of it. And I've noticed even when smiles, if I had one canine tooth on a patient that just stuck out a few millimeters, the lip would not be smooth across it when they smiled, because it would have to follow that convexity and it would create a little blip on the top, on the edge of the lip, and it wouldn't be symmetrical. The solution is not to fill the rest of the lip to kind of make it even, is to really correct the tooth that's pushing that lip out and making it uneven on the edge. So what I call support draping of the teeth or the skeletal system, it's important to look at the underlying structure. And you mentioned it early in our first beginning of this conversation, that you want to get the solid structure first and then build the soft tissue on that, give it a solid foundation of which you can be more predictable in your soft tissue corrections.
Yeah. So here's a photo that I found actually that pulled up. This is what I'm talking about. You see how her face looks strained when she smiles? And on the right side, it's kind of strange. So this is Octavio Cintra's photo, Orthognathic, to work on symmetry. Before, her face is pulling much differently than it is afterwards, even though he did no work on any of the external part. He just did this kind of infrastructure work. And so all these faces, they look less strained. You see her lips before, they're kind of open and the face doesn't look as pleasant there. And then you do the bony restructuring, the lip all of a sudden relaxes and looks nicer and softer. And, these are the things I think people need to understand in the way your face functions.
So Ben, that was a mandibular advancement orthognathic surgery on that previous patient that had a retrusive chin.
Yeah, that was just mandible.
And did she have a chin augmentation, a sliding osteotomy, or bone graft?
Well, he just brought the whole mandible forward. I can't recall, but no grafting otherwise. No, he actually did some kind of sliding osteotomy and brought it forward.
Mm-hmm.
Yeah, but the whole face kind of functions better. Even in this one, if you look at the before photo, she looks sad before, kind of more pleasant afterwards, without that depression on the side of the mouth.
Yeah, you could also make an argument that on the previous slide, it opened her airway. She probably had a better breathing.
Oh,
that mandible
certainly
was advanced.
Yeah, it certainly did.
Yeah,
it certainly did. So we have another question. The question is about lip flips. So have you done many of those lip flips?
Lip flips?
Yeah, just Botox here on the top. Someone's asking if lip flip affects your smile. The thing that I've seen from it is lip flip is going to affect the way that you say B's and P's. So it does weaken them. Just like the phonation, the phonetics that we're talking about. You can't say B's and P's, up, that kind of stuff as much because this part of the lip is weaker. What a lip flip does, you're injecting Botox here. And if you smile and you'll see you close your mouth and you purse it, that move is the muscle that you're weakening. So when you smile, the sphincter portion of the lip kind of relaxes more. I don't like doing lip flips on people unless they say they've had it done before and they loved it, because it just relaxes it and decreases your function. But if you've had it before and you like it, it'll just curl up your lip the tiniest bit.
I've seen the beautiful before and afters from the lip lift. It not only elevates the lip, but actually everts it slightly and gives you a more fuller, vertically taller upper lip. I really like that. Those examples that you showed, it has a multiple effect on it.
Yeah. So the flip itself, just Botox, if somebody's done it before, you can do it. Otherwise, kind of look at other options.
Somebody said, does Botox affect your smile? That was a question I just read on there. But when Botox it's not like what you do, it's how much you do it and how you do it. So if you're anatomically accurate of where you place the Botox, you're only affecting selective muscles that lift vertically that portion of the lip that causes the gummy smile. When we smile like this, there are other muscles engaged. Zygomaticus major is what we call it, from the zygoma to the corner of the mouth. Those muscles are still working 100%. And so you can get that stretching and that smile look without the middle of the lip elevating too high. So if it's done properly, it shouldn't affect your smile. It'll just improve the gumminess of your smile.
Yep. And that's what I tell people. It's very much so how it's done. And I have tons of patients who come and say, well, I did Botox around my mouth before and it just did horrible things to me and I couldn't talk. And well, I said, well, some people are oversensitive to it, but most of the time it's because it was done either too much or in the wrong spot.
Right.
So you back off, you move farther away from the center of the mouth, things become easier and more predictable. The closer you get to the mouth, the less predictable it gets with Botox. So it's very, your brain does kind of interact. It's not like you just go paint something and it's there. You paint something and then the sun hits it and then the rain hits it. Like there's a lot of these, factors going on with your brain kind of relearning everything as soon as you inject it with Botox. So if it's done properly with somebody who's good at prediction, then you're all good. So we're getting close to an hour now, I would say. It's quick when you're having fun. So if anybody wants to see Dr. Rifkin, you can always access him. He's on Camden. You're on Camden, right?
Camden,
yeah.
414 Camden.
Yeah, Camden Drive, very nearby. There's two Rifkins, they're brothers. So make sure, and there's Rivkins. So those are like there's Rivkins, there's Rifkins. So this one's RIFKN, and it's Larry Rifkin or Lawrence Rifkin. There's a whole family of.
Can be confusing.
Yes, yeah.
My brother, myself, or the dermatologist who, I get calls, hey doc, that rash won't go away. And I go, rash? Oh my God, a rash. No, it can't be a rash. Yeah. Talking about the dermatologist. That's it.
Yeah. So within 3-4 blocks, I think there's like 5 Riv and Rifkins actually. So.
Right. I don't know. We're overpopulating the world somehow.
Yeah. All right. So it was a pleasure. Thank you so much. And for everybody else, this podcast will be up. Give us usually a week or so to get it up. And if we have more questions for you, we'll forward them your way. Otherwise, you guys can reach out directly to Dr. Rifkin.
Yeah. Well, I just want to say thank you, Ben. I've learned a lot from you. I think it's enhanced my dentistry, my ability to help patients do the right thing, do the best thing for themselves cosmetically, even if it's no treatment. I love your integrity, and I've seen the results, and thank you for letting me use some of your slides as an example to show what could be done and what should be done in my dental work when I talk about cosmetic smile improvement. And I appreciate the opportunity, because I think what you're doing in this downtime that we have is a major contribution to the public as well as the professionals about just sharing ideas. Your other guests have been amazing, and I really have learned a lot from listening to you and listening to them. So thank you for the opportunity for me to share with you.
Thanks. I'm just trying to learn from you guys.
Right.
All right. Take care, everybody.
Okay.